So,
what is the estimate? And I know you could talk to 10 different people. They could give you 10 different numbers. But from your vantage point, how many physician billing companies do you estimate that there are in the United States right now?
Yeah, there isn't a solid number. Our association has tried to come up with that a number of times, but probably a good estimate is around 2,500 companies, and it depends on how you define a company. My definition is that it's an organization with a business address, meaning it isn't somebody working from their home. They have more than 5 W-2 employees, or they may be not W-2, but they have 5 employees. They have separate software. They're not using the practice's software. They have their own. And they've been in business at least 3 years, because traditionally a new business, whether it's a restaurant or whatever, when they've passed the 3rd year, that's usually proof that they have a sustainable business model. And I think for physician practices, that's an important distinction.
Now, just to, I'm sure there are a number of our listeners out there who know what third-party physician billing companies do, but what do you, from the most simplistic standpoint, what are the type of activities that they engage in?
Well, the obvious would be billing,
right?
Submitting claims, but the broader description would be that the practice, if it's an office-based practice, will identify the services, the patients they provided services for, and the services that were rendered in the diagnosis, and they convey that information to the billing company, and that information is then entered into the billing company's software. In a different version of that, the billing company puts the software the billing company uses into the practice office, and the office staff will do the patient registration and the charge entry and diagnosis information. But the one common denominator is all billing companies are the ones who submit the claims on behalf of the provider. Most of that is electronic now. And in some cases, the billing company has other services. For example, in hospital-based specialties, radiology, pathology, emergency medicine, anesthesia, the billing company provides coding services, which means the practice has to arrange for the billing company to have either access to or copies of the charts so that their professional coders can do the coding. From there are additional services. So there are billing companies, for example, that handle provider enrollment on behalf of the practice, because that is a very complicated and knowledge-intense activity. Most practices don't do it very often, and therefore get a little confused and lost in how to do it successfully, where billing companies do it routinely. There are companies that take that first set of services to a higher level and provide what is loosely described as practice management, and that may be actual consulting on the administration of the practice, but it also can include contract review with insurance contracts, contract negotiation on behalf of the practice, payroll and accounting services. And now in the 21st century, especially in the last 3 or 4 years, billing companies have begun to, in some cases, have an electronic medical record product that they have available for the customers who would like to use the one that the billing company can offer. But billing companies will frequently allow the customer to choose one and then provide the connectivity for the information to pass between the two.
Bob, we're going to take a quick break here from our friends over at MediStar, and we will be back in a moment right here on the Healthcare Business Network.
Are you looking for a billing company that can increase your revenue, effectively manage your credentialing, deliver the right software, and provide guidance in navigating the minefield of compliance? MediStar has been providing the right answers for hospitals and physicians for over 13 years. We go the extra mile by paying attention to the details and focusing on aggressive follow-up. Recognized for 4 straight years by Inc. magazine, Our professionals can help you attain your revenue cycle goals while helping to ensure that your work is done in a compliant manner. Call one of our experts toll-free at 888-423-8080. That's 888-423-8080. Or visit us at www.medistarbilling.com.